All right. So we're going to be talking about breast pain, which the medical term for this is mastalgia. We're going to define what are we really talking about. It seems simple enough, but we're going to define it. We're going to talk about why is this important, and then thirdly, we're going to get into what are some of the possible causes. So if you are someone you know is experiencing breast pain, you can give them some guidance or at least have an idea of what may be serious, what may be not so serious, or what the potential causes are. Okay, so let's get into it. Let's talk a little bit now about breast pain or mastalgia. Mastalgia. And the essentially, we're talking about pain in the region of the breast. When we talk about the breast, we have the nipple, and the dark area around the nipple is areola. And then the raised mound here is the breast, and it extends all the way under the armpit into the axilla, what we call the axillary tail of Spence. So a lot of the times when women experience breast pain, it can be anywhere along here. It can be in the region of the nipples, it can be in the axilla, it can be in the breast itself, or it may even extend under the armpit. So that's important to recognize that breast pain can present in different ways and may affect different parts of the breast as an organ. Now, why is it important for us to talk about breast pain in the first place? It's important because, firstly, it's extremely common. Statistics suggest that well over 70% of women will experience breast pain at some point in their lives. Okay. And it's a very common complaint that we as gynecologists see. The significance of it is that it can cause distress, discomfort, which can affect a woman's quality of life. It can also cause psychological discomfort and distress because of the fear as to what could this be. Does it mean that, because I'm having breast pain, does it mean that I have breast cancer? That's quite commonly the reason that motivates women to come in, because if I'm feeling pain in the breast, it could, what is this, something serious? Is this something that I need to get sorted? And especially if there is a family history of breast cancer, or there's an acquaintance, a friend, a relative who may have had breast cancer, it causes a significant level of anxiety and fear. And then, of course, in the context of pregnancy or after pregnancy, may indicate potential serious underlying issues. And so it's something that's important for us to discuss. I'm happy to have the privilege of sharing this knowledge with you. Okay, so let's talk a little bit now about the possible causes and see if we can also get into what information may help you figure out what's going on, at least to have an idea and what to expect when you're going to see your physician. When we talk about the potential reasons for breast pain, there are a number of different reasons, but the likelihood of what the cause might be tends to depend on what stage of a woman's life she's in. So things may be different between a woman who is of reproductive age, which may be a little bit different from a woman in the postmenopausal period. And then, of course, even if for women within the reproductive age group, there may be differences whether this woman is pregnant or not, or whether she has recently been pregnant. It gives us different clues. So let's start with the first thing. Most of the time, the cause is not cancerous. Most of the time, the cause is benign. Most cases of breast pain are not due to breast cancer, which is reassuring to some extent. When we talk about breast pain, and let's go back to the image here, one of the first things is to differentiate between whether this pain is cyclic or not, meaning whether it is in relation to a woman's menstrual cycle. Women who are going through their menstrual cycle may find that they have breast pain, and usually this precedes the onset of menses or the period. And usually this is as a result of hormonal changes, particularly progesterone. Progesterone tends to peak prior to the onset of menses. And so progesterone actually stimulates the growth of the glands within the breast. The breast tissue is comprised of three main components. One is fat, the other is glandular tissue, and the third component is fibrous tissue. The fibrous component is interspersed between the fat and the glands and helps to maintain the shape of the breast. Okay. And it's really that fibrous component that becomes stretched with time, why women's breasts sag over time. Okay. And then the glandular component is what eventually produces the milk whenever a woman has a baby. And that's pretty much consistent in all women. That's the reason why a woman with small breasts can produce as much milk as a woman who has large breasts. So it is really that glandular component is pretty consistent. What ultimately decides the size of the breast usually is the fat component. Women with larger breasts tend to just have more fat within the breast than other women, and that differentiates the size. Now that we have a basic understanding of the anatomy and the components of the breast, then we understand that glandular tissue is the component that's most responsive to hormones. When exposed to high levels of progesterone, that glandular tissue tends to undergo what we call hyperplasia or growth and begins to stretch the fibrous component that holds the breast in its shape, and that now causes pain and discomfort. This is a common thing that we see. The most, if not the second most common cause of breast pain is actually the stretching that comes from hormonal changes. We can see this before the period. We can see this in women who are on oral contraceptives or any form of hormonal contraceptive for that matter, because invariably hormonal contraceptives contain progesterone in some form. We can see this in the context of pregnancy and the postpartum period. Hormonally related breast pain is probably the most common reason for women having breast pain, especially women of reproductive age. When we talk about non-cyclic breast pain, now we're talking about pain that's not related to any kind of hormonal medication, that's not related to the menstrual cycle. And usually in that case, the most common reason is probably going to be issues that have nothing to do with the breast, really. Let's jump back to that image that I was showing you from the Women's Health Doc site. We can see here that there are nerves that are innervating the breast, nerves that give sensation to the breast tissue and to the skin over the breast. And these nerves come off the spine and they travel around under the rib cage and they come around to the breast. So what this means is that any pathology really, any problem that's occurring along the spine, along the chest wall, can be referred to the breast. So a lot of times when women speak about breast pain, it's actually referred from issues in the back. So muscular spasm that's leading to compression of the nerves, for example, or a disc in the spine that's prolapsed, or if there are arthritic changes in the spine that are irritating nerves, then you can have pain. And typically the pain radiates around from the chest wall to the breast. Sometimes it's just inflammation where the ribs actually meet the cartilage of the sternum, what we call costochondritis, that is actually leading to the breast pain. And quite often a simple examination of the breast can help in elucidating that cause. The breast itself is actually structurally normal, but the pain is referred due to something else. And that's usually the second most common reason. Then we get into specific breast issues that may cause breast pain. Most commonly, we see this around the time of pregnancy and the postpartum period. Women who are breastfeeding may sometimes get irritation of the nipple, pain in and around the nipple and the areola area. Areola is really just this dark tissue around the nipples. Sometimes, for example, in the postpartum period, women can have issues related to the glands. This is commonly an issue because the glandular portion of the breast is producing milk. The milk is produced within the gland and then goes through the ducts that lead to the nipple where it's secreted. And if one of these ducts gets obstructed or blocked, then you can have pain in the breast. Usually it's localized to a particular area. Sometimes you can actually feel a lump there. This is usually because of a blocked milk duct, and over time may cause what we call a milk cyst, which is just a collection of milk in an area of the breast, which can be painful, a localized area of pain and discomfort. And if unaddressed, sometimes can actually lead to infection. This has to be differentiated from what we call engorgement of the breast, which is a generalized swelling of the breast because the glands are just filled with milk. It happens quite often, for example, if women are not breastfeeding enough and not emptying the breasts enough, or if the unfortunate situation where a woman may not be able to breastfeed either because of some underlying medical issue, medications, or if it's a situation where the baby has passed away and you may have engorgement of the breast that causes pain. And those are usually the more common causes of breast pain in the context of the pregnancy and the postpartum period. Perhaps less common, but particularly important, is infection. This usually is when, for example, one of these blocked ducts becomes seeded with bacteria and you have what we call a breast abscess. Usually before you have a breast abscess, you may have generalized infection. We call it mastitis, but it's more superficial, while a breast abscess involves a collection of pus in a particular area. And typically extremely, extremely painful. There's exquisite tenderness over the area of the abscess. The woman may have fever, may be experiencing generalized feeling unwell. And this is something that requires urgent attention to prevent severe systemic infection, as well as to avoid long-term damage to the structure of the breast. And most times can be easily treated with a combination of antibiotics as well as draining of the infectious material from the breast. Typically, that's the kind of setting that we're seeing in the context of pregnancy and the postpartum period. When we talk about especially the postmenopausal period, we have to be more careful because that's when the highest risk of breast cancer is present. The risk of breast cancer goes up after 40, of course, but tends to start to rise more quickly once you get beyond 50. The average age of menopause is about 51. So for women who are experiencing discomfort after the menopausal period, most times it's still a benign issue that we've discussed before, but then there's a higher risk of it being cancer related. It's important to state that there are some cancer syndromes that may present with breast pain and inflammation. One of the classic conditions is inflammatory breast cancer. We always talk in medical school about a powdered orange appearance of the breast, which means it just looks like the skin of the orange or the peel of the orange. And this is because of inflammation. And sometimes this can be due to infection or mastitis, but sometimes it can be due to cancer. If we're seeing this in a postmenopausal woman, it raises concerns. We may treat for infection, but if it's not improving, then we have to consider the possibility of breast cancer. But the truth is, the majority of cases of breast cancer don't present with breast pain. Usually, if breast pain is present, it's a fairly advanced cancer. Most times, women with breast cancer may not have a lump until it's quite advanced. The key thing in the postmenopausal age group is screening. Screening is going to be the key because the idea is to detect this before it places a woman's life at risk. And of course, today with the treatment options available, if we diagnose breast cancer early, then outcomes are excellent. And so therefore, the key point here is to say, let's not rely on the presence of symptoms when we're talking about breast cancer, but ensure that you're doing your screening. That's key. In another video, we'll talk a little bit about breast cancer screening to help you get some perspective on that. I hope this video was useful to you. If it was, then be sure, if you have not already done so, to smash that like button and ensure that you have subscribed and share this video so that others can benefit. And let's do this together in ensuring that we educate our women and allowing them, empowering them rather, to live happier, healthier lives. This is Dr. C, the Women's Health Doc, and I'm signing out until the next time.